Hi, everyone, and welcome to another Lancaster Safety Webinar Wednesday. If this is your first time joining a Lancaster Safety webinar, let me just give you a little bit of background. Lancaster Safety is a nationwide OSHA compliance firm specializing in keeping employees safe on the job while keeping businesses OSHA compliant. We've been recognized by OSHA as a VPP Star Mobile Workforce, which is a prestigious accomplishment. We've worked directly with and alongside OSHA compliant safety and health officers, and we even have a few former OSHA officials on our team as well. Most importantly, our goal is to help businesses keep their employees safe on the job and return home at the end of every day. Our team is truly passionate about safety, and we host various safety and health webinars for free in order to pay it forward and provide helpful information that might just prevent accidents. So I'm here today with Dean. We all know and love him. Dean, thank you so much for being with us today.
Emily, it's my pleasure. Happy to do this. I've been safety crazy for a long time. As a young person, I personally witnessed a fatality. And after getting over the shock of it, it just made me angry because it was completely preventable. So safety has been a part of my being, if you will, for a long, long time. And I know it takes some work, it takes some effort and thought, but I know it can be achieved. We went one stretch of almost over 2.5 million man hours without a recordable incident. So I know zero can be done. So we're looking forward to this. And we spend a lot of time at work. A good portion of our waking hours are spent on the clock. You couple that with factors such as anxiety, stress, less than ideal eating habits, lack of mobility, current events, and that can result in overall poor health. So in this webinar, what we'll be reviewing is what a workplace health and wellness program is. Why should we establish and maintain a workplace wellness program, and what can be the impacts? We'll discuss the process of achieving a wellness program buy-in, including design, analysis, implementation, evaluation. We'll also take a look at examples of employee engagement and involvement and why it is so important.
Okay, so Dean, what is a workplace health and wellness program?
Well, Emily, simply put, it's a set of health promotion and protection strategies developed and put in place by the employer. This can include things such as programs, policies and procedures, benefits, environmental supports, incentives, and resources to the surrounding community designed to encourage the health and safety of all employees. These programs are usually offered through the employer worksite. They can maybe also offered by insurance companies. A workplace health and safety program, in most cases, is a proactive and/or preventative measure geared to help avoid illness, but also to improve and maintain healthy conditions at work. With so much emphasis placed on other safety-related concerns, such as machine guarding, fall protection, fire prevention, it's sometimes easy to lose sight of the fact that workplaces will not function without a strong, engaged, healthy employee base. So again, Emily, healthy workers are happy workers. I didn't just make this up. We don't need a bumper sticker. It's simply true. When you design and maintain an employee health and wellness program, it is an important step in improving the overall health and productivity of employees. And let's not forget about the lowering or reducing of the overall cost of employee-provided health care. Let's be clear, a well thought out, well-designed, comprehensive health and wellness program will benefit employers by lowering healthcare costs, reducing absenteeism, achieving higher employee productivity, reducing workers' compensation claims and disability-related costs, reducing injuries, and improving employee morale and performance.
Okay, so now you've made the decision to start a health and wellness program. It's a great choice, but how do we do it?
That's a great question. So one way to get this ball rolling on establishing a health and wellness program is to break the process down into steps. A well-rounded step-by-step process is referred to as a workplace health model. And there are 4 main elements or factors that are included in this. A workplace health assessment, a planning stage where details like program direction, leadership, and organization are determined, the actual implementation of the program elements, and lastly, program evaluation. So let's look at these in turn. The first step is performing an assessment, is to gather information on factors that can make or break the health of your workforce. Ultimately, this assessment should not only identify some of these risk factors, but also ways that you can correct or improve their impact. or potential impact on employees. The assessment gives us a snapshot of the current state of health of the company, in addition to ways on how to improve it, and it will result in many benefits that have already been mentioned.
All right, Dean, so what type of factors should we be looking for in all of this?
Well, that's an excellent question. I think there are 4 specific areas of factors that can have an effect on the health and wellness of the workforce. First, the individual. We're all different. That means we're going to have a lot of elements of our health, such as behaviors, health risk factors. It could be things such as high blood pressure, current health status, all kinds of things can be assessed. The second component builds upon the individual, and that's interpersonal. These are elements of your social network that include relationships between coworkers, managers, family members, work family, and personal that provide support, as well as mentoring or role models. Third are organizational elements, your workplace culture, structure, policies, procedures, and practices, benefits, health promotion programs, work organization, leadership, management support for workplace health and safety initiatives. And lastly, it's the environment. Where do we live? Where do we work? That environment plays a major role in shaping who we are and what we do. So identifying elements of the physical workplace, as well as access and opportunities for health promotion, provided by the surrounding community where employees live, is extremely important as well.
Okay, so we have established that an assessment should be performed, but what exactly do we assess? So remember that a workplace health assessment involves learning about a workplace and the health of its employees. Now consider the notion that employee health is determined by a complex set of interactions between the individual and their social, cultural, and physical environments and can be influenced in many ways. Now for these reasons, it's important to assess employee health from a number of perspectives using multiple sources of data. We want to gain a complete picture of what could determine employee health. So for example, reviewing healthcare costs will provide information on which health conditions are the biggest contributors to the total, but that doesn't provide insight into what factors contribute to those conditions.
Emily, that's exactly right. The key is we can look at numbers and statistics all day long, but we have to go a little deeper to understand causal factors. So these types of data sources will be available, but depend on the workplace. Some data is readily available. Other maybe have to be requested from a third party. Some may not be currently available. So you got to decide whether you're going to collect the data or not. The types of data sources used to gather information in the workplace may include site visits. I tell you what, the best way to find out what's going on is actually, as I say, management by walking around. Make personal observations of the workplace setting, interviews with managers and employees, discuss health attitudes and beliefs. And while subjective, it helps give an overall setting of where you're at. You can also review current health promotion programs and policies and procedures, as well as evaluating the workplace environment for potential health risks. Another way is an employee survey. This could be a health risk appraisal, employee satisfaction and interest surveys, safety surveys, routine inspections, and the like. What these surveys may focus on is maybe a single health issue. For example, what's the daily physical activity levels? Encompass a wide variety of issues and beliefs such as nutrition, physical activity, use of tobacco, alcohol, physical examinations, as well as interests and opinions about a workplace wellness initiative. An employee health survey can be a low-cost way to assess the health attitudes, beliefs, and behaviors of a given employee population and helps provide information when planning new programs and policies. Another source is your healthcare and pharmaceutical claims. Take a look for common health conditions and procedures for which employees are seeking healthcare and the costs associated. You can also take a look at time and attendance, injury and participation in or satisfaction with or outcomes from other employee healthcare programs, absenteeism. So we have a lot of data sources that can help you understand what are the causal factors that will help me determine and what to assess. It's also important to remember that having support from management is essential to having a successful wellness program. Without this and buy-in from management, you will not get buy-in and participation from the employees. Buy-in from management is critical for funding, for time frame. You'll need to be able to communicate the value of this wellness program in order for it to succeed. It can't simply be a new or improved policy or procedure that gets sent out in an email.
So having a wellness committee will help get employee involvement, and they can oversee things like evaluating current programs, services, and policies that are available in the workplace. They can assess employee needs and develop a health promotion. They can even assist in implementing, monitoring, and evaluating the activities. So employers can ask for volunteers and ensure that people from different departments are involved to make sure that there is input from a broad sample size of the company.
Emily, that's exactly right. There are so many different components that go into your organization's wellness program, and this can be structured based upon your needs. So the information can be found out from what was gathered during this assessment. So some different components might include reducing stress, weight loss, health screenings, nutrition education, warm up or exercise program and activities.
So it's important for the overall workplace health program to contain a combination of individual and organizational level strategies and interventions to influence health.
Emily, you're exactly right. There are two types of health programs and services, which can be categorized as either informational approaches or behavioral social approaches. So let's take a look at each. Your informational approach are directed at changing knowledge or attitudes about the benefits of and opportunities for healthier lifestyles. The behavioral or social approaches are designed to help employees understand the behavioral management skills necessary to successfully adopt and maintain the behavior changes. There are plenty of things that can be done as part of your workplace wellness program. For example, I could have classes or seminars on health topics such as fitness, nutrition, tobacco cessation, or stress management. I can do weight loss programs, offer counseling, education, information on nutrition, exercise classes. It can be a variety of items for weight loss programs, including counseling, education, and nutrition, and exercise classes, which include simple stretching as well as full workouts. Ergonomic assessments and equipment, making the work fit the person, not the other way around. On-site vaccination programs, the EAP or Employee Assistance Program, where employees can confidentially contact outside services for assistance with personal issues, addictions, and the like. Also, chronic disease self-management tools. What do you see as things happening over time? Emails, newsletters with health information, YouTube channels, websites. There's all types of ways your employees understand here are some things you can look at as part of your workplace wellness program.
Along with programs to get employees involved, educated, and more, you can also implement health related policies that will also benefit employees, whether directly or indirectly. So, some examples of that can be policies prohibiting tobacco and alcohol use at the workplace, policies requiring healthy foods to be served at company meetings and events, policies allowing for flex time to exercise or attend health programs. Policies like these make it easier for employees to make healthier decisions throughout their day, and it helps create an accepting culture where people want to be healthier. Other company policies that aren't necessarily health related can impact employees' health, like vacation time, work hours, and more. Having a good work life balance is a great way to keep everyone feeling good and not be too stressed out.
Emily, you're exactly right. That healthy balance is key. And one way to help your employees enhance this balance and enhance their health and wellness is to make the work environment inducive to healthy habits. For example, an on-site fitness facility, maybe a walking or running trail, could be a basketball hoop, just open green space. People can go out and exercise and relax. Yes, maybe even in the winter. Healthy foods available on on-site cafeterias, vending machines, snack shops. You can also include a supportive supervisory structure where this is encouraged. It could be simple things such as a better improved control of dust, fumes, and vapors, or effective and efficient lighting, well-designed workspaces. All of these will help your work environment support health and wellness. If we think about this after all said and done and your program's been implemented, I want to gauge how effective has it been for our company, organization, for our employees, and the organization as a whole. It's a couple different ways you can measure this. You can look at employee productivity, should it be increased? Healthcare costs, health outcomes, claims. These could be some noticeable changes in your organization that will improve it. There are many employers who are unaware of the linkage between workers' health and productivity. In fact, the indirect costs of poor health, which will include attributes such as absenteeism, disability, reduced work output, poor productivity, tend to be higher than the direct medical costs. In my experience, Emily, I have found that for every dollar I spent on a health, wellness, or safety issue, by the time I was done, that I could measure, I spent 20. Other people's experience may be different, but you get the idea. And these kinds of costs are going to affect other employers and employees, even ones who avoid direct medical costs by not paying for health insurance or have health savings account. The whole purpose is a workplace health and wellness program will help in reducing or controlling illnesses that will affect the productivity, quality of workers and the company. You'll find the employees, managers, everyone will experience improvements in their physical, mental, and emotional health. This will in turn enhance stamina, concentration, and focus when working on different projects. This in turn will improve your quality. It will lessen defect. It will reduce absenteeism. It will basically help and improve the morale. Sometimes it's hard to measure, but it is not that difficult when you do have an effective health and wellness program. Again, some ways to measure your effectiveness. Take a look at where you started and compare things. It could be costs, timeframes. Take a look at your absenteeism that are due to illness or injury. Take a look at the fact that you have reduced overtime because now you don't have employees covering ill employees' shifts, as well as the cost to replace and train new employees, which can be exorbitant.
Insurance premiums are constantly increasing, and employers need to decide to make changes in the workplace to help curb the rising costs. Workplace health programs can help lower insurance claims, workers' compensation, and other healthcare costs. So, having healthy employees stay in the quote low risk category and also helping others who may be high risk will help with lowering insurance costs overall.
Emily, you're exactly right. After all, what is insurance? It basically is sharing the risk reward. The higher the risk, the higher the cost, coverage, etc. The lower the risk, the lower the cost. It comes down to that basic economically. But it's more than that, because we're not just talking about balance sheets. We're talking about individuals, basically without whom we can't run our organizations. So this is truly a team approach. So what are some ways to measure this? Well, you can assess the changes in the number and type of health insurance claims, hospitalizations, outpatient visits, or even prescription and pharmacy claims. Also, what has changed in the utilization of healthcare overall? More and more preventative and predictive health services, such as cancer screenings and other tests, are a great way to measure your program effectiveness. After all, if we find some serious illness or disease, it can be caught early. You have a lot more options and a lot more positive outcomes. Another way, too, is just take a look at the changes in your direct medical costs due to illness or injury. Have they gone up or down? It's really pretty straightforward. Looking at investing in your companies as well as your employees' health and wellness program will not only help them, but it helps your bottom line when it comes to savings related to medical costs.
Lastly, after all said and done, when looking at productivity and cost savings, you can see just how much your employees are personally benefiting from these programs. You can observe them feeling better, happier, and more. When employees participate in programs like this, they can develop knowledge, self-management, and coping skills, along with building a social support network with other coworkers, supervisors, and their family.
You're exactly right, Emily, because adopting healthy habits in the short term will help with health in the long term. Having employees take this home will help their families. So it's a real win-win situation. And over time, you can measure things such as targets for optimal levels of health. What percentage of employees are reporting good or excellent health? What percent of employees have lower illness or injury rates? How many employees are working or have gotten to a healthy weight following a weight management program? These are all factors to look at when you're measuring the effectiveness of your wellness program.
A happy, productive workforce lowered medical and insurance costs, lowered indirect costs from having great employees who are thriving in their health. Everybody wins with a wellness program in their workplace. And this is a great way to invest in your employees' well being. And then in doing so, the return is mutually as beneficial. Now, everyone is entitled to a healthy and safe workplace. Promoting healthy habits will improve the overall workplace environment, which in turn helps with safety.
Well said, Emily. We hope those of you who enjoyed this seminar and was able to provide you some ideas and information that you can utilize in your company. Lancaster Safety is happy to help when needed, give tips and advice on how to manage your program and make it effective and efficient as possible. So if anyone has any questions, we'd love to hear them. Emily, it's been a real pleasure sharing this time with you. I thank you for the opportunity.
As always, I love having you here with us on these webinars. You teach me just as much as you teach everybody else. So thank you for that. And thank you everybody for joining us today. We really appreciate everyone in attendance here. Each of your safety challenges will be unique, and we know that frustration often occurs because people don't know where to turn for help. So we here at LSCI take away that burden of doing OSHA research, determining what topics will address your project safety, company program, and training needs. So like I said before, we create programs and conduct the trainings for you with highly qualified trainers, just like the ones that we have here, like Dean today. So give us a call today at 888-403-6026 or visit our website at lancastersafety.com. Everybody have a safe and healthy day.